Hello guys, so welcome back. Today we shall be discussing one of the most important topic, right? We'll discuss one of the most important topic where we shall be discussing that bacteria which is the worldwide third most common cause of urinary tract infection, right? So that is your Klebsiella pneumonia. So anyways, as we discuss everything from the starting, we shall be starting on with the general properties, the general characteristics of the bacteria, and then we shall discuss the pathogenesis of how each and every disease is happening, right? So first we shall discuss the general properties or general characteristics. So regarding the general characteristics of this bacteria, you have to keep in mind few important things. What are those few important things are? The first important thing is, first of all, whether this bacteria is a gram positive or a gram negative bacteria, right? So this bacteria has got a thin peptidoglycan layer. If it has got a thin peptidoglycan layer, so obviously you know it is a gram negative bacteria. And those bacteria which have got a thick peptidoglycan layer are called as gram positive bacteria. So this is a gram negative bacteria. Second important thing is, unlike the other bacterial species, this bacteria do not produce any spores. So it is a non-spore forming bacteria. If you ask me, can you tell me some bacteria which form spores? Yes, the Clostridium species, all the Clostridium species, they form spores, right? They are spore forming bacteria, but whereas this Klebsiella pneumonia is a non-spore forming bacteria. So this is a non-sporing bacteria. This is a non-sporing bacteria. Third important thing which you need to know is that this bacteria, Klebsiella pneumonia, do not have any kind of cilia or flagella, right? So if it is not having flagella, can it be motile? No. So it is non-motile. So this organism is a non-flagellated organism. Hence this organism is non-motile. Right. So these are some of the important things. But now we have to learn some more things which are too much important. What is that? This bacteria can ferment lactose. It is a lactose fermenting bacteria. Okay, let me write it down and then I'll explain you what is lactose fermentation. So this is a lactose fermenting bacteria. This is a lactose fermenting bacteria. Now what do you mean by lactose fermenting bacteria? For example, this is a bacteria over here. This is a bacteria over here, right? Now this bacteria, let us say for example, this bacteria is having its own cytoplasm, and within the cytoplasm you have got very good enzymes, and this bacteria releasing an enzyme, and that is called as beta galactosidase. It is releasing an enzyme called as beta galactosidase. And what does this beta galactosidase do? This beta galactosidase will convert lactose. It is converting lactose into two important compounds. One is called as galactose. Another one is called as glucose. Okay. So this bacteria is converting into two different compounds. One is called as glucose and the other one is called as galactose. So lactose is fermenting into glucose and galactose. This process is called as lactose fermentation. And this is mediated by an enzyme called as beta galactosidase. So this bacteria is a lactose fermenting bacteria. Okay, fine. So can I look with my naked eyes whether this bacteria is releasing beta galactosidase? Obviously no. How can you look an enzyme? You cannot look it. But I can prove you that this bacteria is lactose fermenting bacteria. Now how do I prove this? How do I prove that this bacteria is lactose fermenting bacteria? How do I prove is, look here. For example, I take an agar plate. Okay, I take an agar plate. Now in that agar plate, I will add this Klebsiella pneumonia. Let us say I have added 10 to 15 Klebsiella pneumonia bacteria. Okay, so let me draw a picture anyways, So this is my agar plate over here, and in this agar plate what I have done is that I have added, let us say, okay fine, so let us say I have added around 5 or 6 or 7 Klebsiella pneumoniae bacteria, right? Now this bacteria in that agar plate, I have lactose also, okay, in that agar plate I have lactose also. So what this bacteria did is that it converted all that lactose into glucose and galactose. After that, all of you know, glucose will later on be converted to what? Glucose takes part in which cycle? It takes part in glycolysis. Hope all of you remember glycolysis from your biochemistry. In glycolysis, the first compound is glucose. Glucose is converted to glucose 6-phosphate, then fructose 6-phosphate, then fructose 1,6-bisphosphate, right? Then 3-PG, 2-PG, and finally phosphoenol pyruvate and pyruvic acid. After pyruvic acid is further converted into lactic acid. So you can go through that mechanism and see what is the first compound and what is the last compound. The first compound will be glucose, the last compound will be lactic acid. So in a process called glycolysis, glucose will be finally converted to lactic acid. What is lactic acid? Lactic acid is an acid. So it means within this agar plate, this bacteria is converting lactose finally into lactic acid. It means within this agar plate, acidity is increasing, which means in this agar plate, the pH is slowly decreasing. And one thing I have to tell you, that this agar plate, whatever agar you have used in this plate is very sensitive to pH. So if pH is falling, then this agar which you have used is so sensitive to pH that all these colonies, all these bacterial colonies will immediately turn to pink color. Okay, so all these bacterial colonies will now immediately turn to pink color. Can you tell me the name of this agar? This agar is called as McConkey agar. This agar is called as McConkey agar. So with the help of this McConkey agar, I came to know that whether this bacteria is what? Lactose fermenting or non-lactose fermenting. If the bacteria is not fermenting lactose, then the acidity or the alkalinity of the agar plate won't change. So even the bacteria also remain colorless, right? But this bacteria is fermenting lactose into lactic acid. So in the agar plate there is high acidity, and that high acidity caused the bacterial colonies to change its color, right? So they became pink color. If you find pink color colonies within the McConkey agar plate, it means that you have added a lactose fermenting bacteria. I hope this is clear for you, right? Next important thing which you need to know and take into consideration is that this bacteria releases an enzyme called urease. So can I call this is a urease positive bacteria? Yes. I'll explain you what is the function of urease, what is the reaction later on. I don't want to write it twice. This bacteria releases an enzyme called as urease, so it is called as urease positive. So what is the function of urease basically? Urease converts urea, a compound called urea, into ammonia plus carbon dioxide. So who is converting this, guys? Urease is converting it into ammonia and carbon dioxide. That is why it is called as urease positive. Now, do I need to know this reaction? Yes, you need to know this reaction because this has got a very clinical importance. I'll tell you in a minute, right? But for now, as far as the general properties which we are discussing, just stick to the point that organisms which release urease are called as urease positive organisms, right? Next important point which you need to take into consideration is that this bacteria is facultative anaerobe. This bacteria is facultative anaerobic bacteria, right? As I already told you that this bacteria is what? This bacteria is the most common cause. What most common cause? Yes, it is the third most common cause of urinary tract infections. Third most common cause of urinary tract infections is this Klebsiella pneumonia. Right. So in the McConkey agar, what type of colonies do I find, guys? In the McConkey agar, I find pinkish colonies. I find pinkish colonies. So if I find pinkish colonies, then I have to infer myself that I'm dealing with a lactose fermenter. Right. Now, having said these are the seven general basic characteristics of this Klebsiella pneumonia bacteria which you have to know. So let us discuss how this bacteria is pathogenic. Okay, what are the virulence factors of this bacteria? Let us discuss the virulence factors of this bacteria or viral factors of this bacteria. Let us say that this is a bacteria over here. Okay, now surrounding this bacteria, you see a blue color layer that is surrounding this bacteria. You know what is this layer is called? This blue color layer which is surrounding this bacteria is called as a capsule. So can I call that this bacteria is encapsulated? Yes. It is an encapsulated bacteria. So when I tell this is an encapsulated bacteria, one thing you need to keep in your mind, that always and always remember, capsule is just it might be just a covering, but if anyone asks you the most important virulent factor, then it is capsule, because capsule is the one which protects the bacteria from phagocytosis. So even if a macrophage comes here, guys, look here, let us say this is a macrophage and this macrophage is coming here trying to engulf this bacteria. Because of the capsule around it, the macrophage cannot engulf the bacteria. It cannot engulf the bacteria. It cannot perform phagocytosis. Right? So can I tell that this capsule acts as an anti-phagocytic? Yes, this is an anti-phagocytic. So here the first thing the bacteria gained success is with the help of the capsule. So are there any more things still? Can you discuss any more things still? Yes. The next important thing is that when you very closely look on the surface of the bacteria, you find small projections that are coming out of the bacteria like this. You see? Now don't tell me these are cilia. Okay, let me draw them little big. Now these cannot be cilia. So these structures are responsible for the proper attachment of this bacteria to the host cell. And these structures here which I have drawn, this structure here which I have drawn, this is called as pili. And what is the function of pili, guys? Pili is responsible for what? Pili is responsible for attachment to the host cell. So can I write adhesion? Pili is responsible for adhesion of the bacteria. Right? Pili is responsible for adhesion of the bacteria. So you told me one thing, that capsule is one virulent factor. The second virulent factor was pili. Can you tell me a third virulent factor? Yes. The third virulent factor is that, guys. So let me draw a picture to explain you the third virulent factor clearly. Let us say this thing is your bacteria over here, right? This was your bacteria. Now, surrounding the bacteria, there was a membrane here, right? So surrounding the bacteria, there is a small membrane that is surrounding the bacteria, and this membrane is called as the plasma membrane. This is called as a plasma membrane of the bacteria. Now, surrounding this plasma membrane, if you closely look here, you have a specific region, so thick, right? So this region is little bit thick. And what is the name of this region, guys? This region is located nearer to the plasma membrane, surrounding to the plasma membrane. So I call it as periplasmic region. Okay. So this region should be called as periplasmic periplasmic region. Okay. Now, surrounding this periplasmic region, you have got one more structure, guys. Surrounding this periplasmic region, what is that structure? You see this? Surrounding the periplasmic region, you have got one more structure, and the name of this structure is peptidoglycan. Okay. Now, surrounding this peptidoglycan layer, the last important membrane which you have here is, look here. Surrounding this peptidoglycan layer, you have got a very important membrane. Look here now. So this is the membrane. I hope all of you know what is the name of this membrane, guys. It is worth drawing and worth explaining because these things really confuse you. So can you name me the name of this membrane here? Yes. So I hope you have seen this. This is called as phospholipid bilayer, right? And the name of this membrane is called as outer membrane. Okay. So by nature, chemically it is called as phospholipid bilayer, but basically it is called as an outer membrane. So this is called as outer membrane. This is called as outer membrane. Now exactly here within this outer membrane, right? Within this outer membrane, you find some chain like molecules here, guys. So look here, you see some small chains that are coming out like this from this outer membrane. You know what are these chains that are coming out of the outer membrane? These chains are nothing but called as your lipopolysaccharide. Where are these chains? These chains are out projecting the bacteria, right? So these chains here, they are called as lipopolysaccharide. Lipopolysaccharide. These are called as lipopolysaccharide. Now, the outer membrane, the peptidoglycan layer, the periplasmic region, all these three things together, you call it as a cell wall. Okay. So you call all these three layers as a cell wall. Clear? So you have got the bacteria. Surrounding the bacteria you have got a plasma membrane. Surrounding that you have got periplasmic region, next peptidoglycan layer, next outer membrane. Within that outer membrane, phospholipid bilayer outer membrane, you have got lipopolysaccharide, right? So okay, what are you trying to tell us? What am I trying to tell you is that this lipopolysaccharide is the third virulence factor. Okay, this lipopolysaccharide here, this is a third virulence factor. How? Look here now very carefully. What is lipopolysaccharide going to do? This is the surface of the bacteria. This is the surface of the bacteria. I'm not drawing the full picture now. This is the surface of your bacteria. On this surface of the bacteria, what happens now? What happens is that you have got complement proteins in your body, and these complement proteins are releasing from your liver. So one complement protein by name C5b. So this is one complement protein. Okay. So one complement protein by name C5b. This C5b goes all the way like this. It moves. Why is it moving? Because it is finding an attachment. It wants an attachment with another complement protein. So what is it looking for? It is looking for another complement protein that is named as C6. So another complement protein will come now, that is called C6. So look here now, this is C6. Now C6 will come and attach to C5b. C6 is coming and attaching to C5b. Now C5b and C6 together, they search for a third complement protein that is called C7. Now C7 also will come and attach. C5b, C6, C7 together, all these three together, they go move like this, move like this, move like this, and go and attach to the next complement protein. Obviously you know it, that will be C8. So all these three are going and attaching to another complement protein, that is C8. Okay, so this complement protein which I have drawn here, this one is your C8. This molecule is your C8. So C7, C6, C5, all of them are attached with a complement protein which is green in color, right? I have quoted everywhere this. So this big green color molecule which I have drawn here, and it has got a pointed end there, that is called as a C8 molecule. So now what is going to happen? What is going to happen is that so far you have got C5b 678, C5b 678. So far this is the complex which has been formed. Now all of these complement proteins in a pack like this, they wander all the way like this, they wander all the way and they search for another complement protein. What is that? Obviously we are following a number order. Obviously what will be that? C9. So where is C9 located? C9 is already on the surface of bacterial membrane. Look here. This protein is C9. Now this complex C5b678 complex will find out that C9 and then it will slowly move towards that C9. Okay, it will slowly move towards that C9. Now look what is going to happen. Now look what has happened. What has happened is that this entire complex went and attached to C9 molecule. You see, this entire complex went and attached to C9 molecule. Can you tell me what will happen now? You know what will happen? What will happen is that the moment this complex attached to C9 complement protein, the C9 molecule starts to proliferate. There will be 2 C9 molecules, later there will be 3, 4, 5, 6, 7, 8, 9, so many C9 molecules. So how are they forming? Look here. All these C9 molecules are like this. There is another C9 molecule here. There is a next C9 molecule. There is another C9 molecule here again. Here the last, and finally these are the C9. So let me make a partition, guys, so that it would be easy for you to identify these C9s. In this way, this means, for example, this is a C5b, C6, C7 and C8 molecule. Now this C5b, C6, C8 molecule, this is C9. It went and attached to C9 molecule. The moment it attached to C9 molecule, C9 will start to divide. One C9 will divide into 2, 3, 4, 5. So all these C9 molecules will start completely surrounding this complex. You see now what has happened? All these C9 molecules, look here, all these C9 molecules, 1, 2, 3, 4, 5, all these C9 molecules, you see how they formed? They formed a pore, they formed a hole in between. So C9 molecule is also called as a pore forming complement protein, because initially there was one C9 molecule, later on the C9 will divide and finally form a cylindrical pore. Okay, and you already know C8 molecule was having a pointed end, so this pointed end will fix into this pore and it will make a hole inside the bacteria. Look how is it making a hole now. You see, it is making a hole inside the bacteria now. It will drill into the bacteria and damage the DNA. So this is how the complement proteins, all of them together, they kill the bacteria. So can you name me the complex? Yes. This is called C5b6789 complex. C5b6789 complex. So all these complex together, I call this as membrane attack complex. This is called membrane attack complex. or simply called as MAC, membrane attack complex, or simply called as MAC complex. Okay, so it is making holes within the bacterial cell wall, leading to the damage of the bacterial genetic material. So if it is making holes, first of all it has to attach to the bacterial cell wall, but this lipopolysaccharide will prevent that attachment. Can I write like this, that lipopolysaccharide prevents attack from MAC. It prevents attack from the MAC, that is membrane attack complex. So how many virulence factors are there, guys? So one virulence factor was antiphagocytic, that is encapsulated capsule. Next is the pili, and the last is the lipopolysaccharide, which prevents the complement system from attacking the bacteria, right? It inhibits the membrane attack complex. So this is the pathogenesis which you need to know. Now coming to another important thing, what are the risk factors? Which group of people are more commonly involved? What are the risk factors? The risk factors are, let us say, those group of people who are diabetic. So patients with diabetes mellitus. Second thing, those patients who are chronic alcoholics. Mostly, if you ask me, the best risk factors, the most common risk factors of this bacteria to infect you is diabetes mellitus and alcoholic. Okay. Third important thing is, for those patients where you put the central line, you put an IV line to the neck here. So you put a central IV catheter. Not only central IV catheter, whenever you put a Foley's catheter, that is a urinary catheter. Patients with urinary catheter, even they are at higher risk. And next important thing is that patients who are been intubated, right? When you put an endotracheal tube, patients who are having endotracheal tube, so even these patients are at highest risk factors. If you ask me to highlight two important things, that will be diabetes mellitus and patients who are alcoholics. These two are the top priority risk factors. Okay, first most important thing is that, look here now. These are your ureters over here. This is your urinary bladder over here, and this is your urethra. Right. What is my main intention to explain you is that, for example, if this bacteria is here in the urinary bladder, this bacteria will release urease, all of you know. So what does this bacteria release? This bacteria will release an enzyme called urease. And what does this urease do, guys? This urease, yes, what will it do? It will convert urea into ammonia plus carbon dioxide. Okay, and all of you know very well that this ammonia which is released here, this ammonia is alkaline, right? So the urine, is it alkaline or acidic? Obviously the urine which is stored in the urinary bladder, that is acidic. So now what is happening is, this bacteria came inside, converted urea into ammonia, ammonia is alkaline, and finally changed the complete urinary bladder from acidic to alkaline. So right now if you look in the urinary bladder, you will find an alkaline urine. So that is how these bacteria are happily living in the urinary bladder. Okay, because all of you know that in the urinary bladder, in the urinary system completely sterile, because it is having low pH, that is high acidic environment, so that no bacteria can live there. But this bacteria is making its way in this way by releasing ammonia and making the entire environment alkaline, and then this bacteria is living there. Okay, fine. So what can the other things that are happen because of this enzyme? What is the other thing that can happen because of this enzyme is that once let me draw the alkaline nature with the green color, okay. So once the entire urinary bladder becomes alkaline like this, you know, green is safe. Once the entire urinary bladder becomes alkaline like this, then you know one very important thing, increased level of alkalinity causes precipitation of phosphate, precipitation of calcium and precipitation of magnesium. So phosphate, calcium and magnesium, they settle down very happily in the urinary bladder now, right? So alkaline environment is the favorable climate for these three ions to settle down, to precipitate down. So they will precipitate down and form stones, and such stones are called as struvite stones. Such stones are called as struvite stones. So let us say, for example, this is a struvite stone here, which you have seen, right? So let us say this struvite stone obstructed your urinary output. So when this struvite stone obstructed your urinary output, can the urine flow out? No. So there will be urinary stasis, right? So what is happening with these struvite stones, guys? What is the thing about these struvite stones? These struvite stones cause urinary stasis. Urinary stasis. And what is happening if there is urinary stasis? What is happening is the urine stays in the bladder for a long time, then slowly new infections start developing in the urinary bladder, right? So the entire urinary bladder gets inflamed now, it gets infected now, and this condition is called as cystitis. So initially, whenever there is urinary stasis, patient will have cystitis. Okay, so what things have you learned right now? One is urinary stasis that lead to cystitis. Okay, fine. Next, what can the other things that can happen? The other things that can happen is that if still you are not treating the patients, if you are still not treating these stones, then what can happen is that the infection can go up. It can go up and inflame your ureters as well. It can go still more up and inflame your kidneys as well. So when your kidneys are inflamed, you know what will be the shape of the kidneys? When the kidneys are inflamed, the shape of the kidneys is lost, right? The shape of the kidneys goes like this. So right now your kidneys are too much infected, and this condition is called as pyelonephritis. So cystitis led to another condition called as pyelonephritis. Pyelonephritis. What can the other thing that can happen to the patient? You know what can other things that can happen to the patient? If you are still not treating this condition, this urine, this alkaline urine will go back into the ureters. Obviously, it will inflame the kidneys leading to pyelonephritis, but this urine stays within the kidneys leading to the enlargement of the kidneys. So when you look at the picture of the kidneys look like this. They are enlarged like this. Okay. So this condition, guys, you call it as hydronephrosis. Hydronephrosis of your kidney. So finally, pyelonephritis will lead to what? It will lead to hydronephrosis. Pyelonephritis will lead to hydronephrosis. Okay. So these are all the things that are associated in the patient with the bacteria in the urinary bladder, right? For example, if you are putting a Foley's catheter into the patient, and if the patient after 2 or 3 days, if the patient is complaining of severe burning sensation there, severe pain, right, then you need to think there might be an infection, because Foley's is a very good way to directly send the infection into the urinary bladder. So in that case, if you are not treating the patient at all, if you are not removing the folies or changing the new folies, then these all the things can happen in the patient. Right. So what are the conditions that are associated with this patient? Associated conditions. What can be the conditions that are associated? The first important condition is, we are discussing Klebsiella pneumonia. So patient can have community acquired pneumonia. Community acquired pneumonia. Patient can have community acquired pneumonia. Second thing, when there is infection in the lungs, let us say these are the lungs of the patient, right? These are the lungs of the patient. So when there is pneumonia in the lungs like this, don't you think there will also be an abscess that is formed, right? So this condition is called as lung abscess. This second condition is called as lung abscess. So whenever there is abscess, obviously when the patient will cough, what will happen? Whenever there is abscess, when the patient will cough, the entire material, right? So all this material is expectorated outside. So this comes in the form of a rusty sputum, right? So this is called as current jelly sputum. So lung abscess will lead to sputum, and this sputum is called as current jelly sputum. Red currant jelly sputum. Red currant jelly sputum. Okay, the sputum is called as red currant jelly sputum. Right. Third important thing, patient will have UTI, that is urinary tract infection. So whenever a patient is having urinary tract infection, so he will complain of burning sensation, suprapubic pain and all. These are the things. Okay. Right. So now let us discuss the treatment. What is the treatment that is given to the patient, guys? The first line of drugs you give is third generation cephalosporins. You give third generation cephalosporins. Not only third generation cephalosporins, you also give carbapenems. Along with the carbapenems, you also give glycosides, that is aminoglycosides. Okay. Thank you so much.